Hello, everyone. Today we have a very special guest, Tatiana Carpio. She's a doctor from Peru who just matched into general surgery in the US. We will talk about her journey, why she chose surgery, how she studied for her exams, her research experience, and her tips for other doctors who want to train in the US. Dr. Tatiana Carpio, thank you for being here. To start, please tell us a little about yourself.
Hello, Irving. Thank you so much for the interview. Hello, everyone. Well, let me introduce. I'm Dr. Tatiana Carpio. I'm from Lima, Peru, and I'm a graduate from Cayetano-Heredia University. And recently, as you said, I matched into general surgery at DHR Health in Texas. And well, I'm deeply passionate about surgery, research, and of course, doing mentorship. That's the reason that I'm here. And currently, I work as a patient monitoring manager. I focus in improving patient care quality at Clinical Golf here in Lima. And well, with this experience, I gained a leadership and administrative skills that let me grow also as another part of the medicine. And well, outside of medicine and beyond that, I really enjoy to practice Pilates, cooking Peruvian food, and spend quality of time with my family and my two beautiful cats.
And why did you choose general surgery, and when did you make that decision?
Well, something that I really liked from surgery's fast pace, hands-on nature too. You're always working with your hands, so that's something that really attract to me. Um, Another thing is that when I was in medical school, like the fifth year of my career, I got the opportunity to be more in the OR. Thank you to the doctors and mentors that I have at the university and the hospital that I was trained as a medical student. And something that I really noticed was the teamwork, something that really attracted me, and how they work under pressure and be part of the team. I knew that it was my calling. I remember that I participated in different surgeries since I was a medical student. Of course, that my mentors taught me everything since the beginning, and that's the reason that I'm really grateful to my university, to the hospital, Cayetano-Heredia, and the mentors that opened to me the doors and let me know that this is my path.
And since when did you start preparing for the USMLE steps or journey?
Well, I graduated in 2020, but during my final year of medical school, I was diagnosed with a natural septal defect. So at that moment, I could not have the surgery because I didn't want to stop my studies. I wanted to finish medical school, and my symptoms were not so bad. But my symptoms get worse, and I got surgery like June 2020. That was during pandemic, so my recovery was really long, like a lot of months. But I knew that I wanted to start my journey to take the step. So I wait to be like fully recovered, and I start my journey like July 2021. That I start like 100% in that I wanted to pursue the general surgery residency in the US.
And what resource did you use to study for step one?
Well, and nowadays there are many resources, and I believe that there are different ones that can adjust to each one. In my case, the most fundamental was UWorld for the question bank and the book First Aid USMLE Step 1. So both of them were my must that I needed. But also I supplemented with other resources. Like for example, for pathology, I use Pathoma. Really helped me a lot. For example, for microbiology and pharmacology, also I use Sketchy. It was really good for me. I really like it. And also I added Words and Beyond. Uh, Additionally, I made my own flashcards because I think that repetitive space repetition, that's the word, space repetition, it's really important because you have to remember a lot of things and a lot of subjects. So it's like a lot. And finally, I used self-assessments from UWorld and also from the MBME. Everything, all my preparation in my case took me like 1 year, like approximately for me. But I met people that can do it in 6 months, others more than 1 year. So I think like each person is different and depends like how you get with all the information, that it's like a lot.
And how did you organize your time for step one preparation and maybe your daily routine and how long was your preparation period?
Yeah, so at that time when also I started to study for the USMLE for the step one, I also was working. So I have to have a balance, work-life balance, basically. And in that case, my routine was like waking up. I woke up like 6:30 a.m. to start working out. And then like 8 a.m. to 5 p.m. I was just working everything related to the clinic and sometimes some research and meetings that I had. So basically my study period or study schedule began like 6 p.m. until 11 p.m. Of course that those 5 hours no were not straight. Always I have like break times, like 15 minutes, something like that, to refresh and breathe and start again, because it's like a lot of information. At that moment I started first reading, for example, one chapter from the book from first aid, and then additionally I did like blocks of questions from question bank, like 20 questions at the beginning because it was something new for me. But then I finished, like I did like 40 questions per day. And after that, reviewing flashcards. So basically that was my routine during the day, but every day, like Monday to Saturday. But something that is really important is also to rest. So Sundays for me were like vital. There were a study of no study, just spending time for me with my family, going out with my friends, and then start all over again. I think that it's really important to have a balance with the work, yourself, and the study. So that's basically how it worked for me.
Now, let's focus on step two. What study materials did you use for step two?
Yes, so since I finished with my step one and I got a really good base, a really good beginning, because I didn't left time between my step one and my step two preparation. So basically for the step two, I used the question bank from UWorld and also a Divine Intervention podcast. So it was really helpful for me. Additionally, I used flashcards that I made, new flashcards, and sometimes if I had any doubt, like from any subject, I came back to my book First Aid. My book First Aid helped me from step one to review any doubt that I have. It really helped me too. And also I took the self-assessments from UWorld and from the MBME.
Okay. And how did you organize your time for step pardon. Okay, de otra vez.
No,
Uh,
no, no.
and how did you organize your time for a step two preparation, maybe your study plan, and how long was your preparation period?
Yeah. So this period was shorter than step one, because step one, as I mentioned before, took me like 1 year. But for this was only 7 months. Yeah, 7 months. And also my routine was basically the same because I was working too, and I was involved in other research projects. So I have to do again on a schedule that I can balance the three of them. So was the same. I woke up 6:30. Always, I think that it's important, you have to take care of yourself. So for me, was going to the gym and working out in the morning, like 6:30. And then I was in the work 8 a.m. to 5 p.m. Everything was related to the work in the clinic, all the pendings that I have from research that I was doing. And my main study sessions was the same, 5 hours, 6 p.m. to 11 p.m. But I think this was more like easier than step one because I had less resources to use. But I had to study a lot my question bank, because the step one is really important, because as if you compare step one, it's only pass fail, and step two, now you have a score that really matters when you are applying to programs. So you have to really give all of you to this from this exam. And I started studying like 6 p.m. to 11 p.m. and just like, as I said before, question bank, reviewing my flashcards. And when I had free time, like for example, I was doing other things like cooking or maybe driving to the work, I was focusing listening the podcast for divine intervention. It really helped me. So I tried to balance. And a key part from all of this preparation was taking the self-assessments from UWorld and MBME. I think I took it like always 1 month of a study, and I took one self-assessment, and also really near when I was going to take the exam. So I think self-assessments are really important because you can track your progress, you can learn new things, and also to notice which subjects are your weakness and how you can strengthen those parts. So basically that was my study sessions for a step two.
If you were to look back and if you had to do the steps again, what would you do differently?
Well, something that maybe a mistake that I did, and I would love to maybe change if I came back. But basically to study at the same time the first aid book and parallel at the same time do my question bank. So when you're going to start to study your book for the steps, for the step one, for example, you have to do your question bank. It doesn't matter that, for example, you are reading the book and you are in the chapter of, I don't know, macrobiology. And if you do your block of questions, like for example 40 questions, and those questions are randomized, like for example pediatrics or genetics, biochem, I think it's going to help you a lot, because also you are going to do a space repetition from other subjects that maybe you are not reading at that moment to the first aid, but it's going to help you to like get in touch with new information, and at that moment you will know how to organize your key concepts. And I think that's something that I will change. I think that in my case, I did first I read part of the first aid at the beginning, and then after like, I don't know, 3 months, I did my question bank. So I think that was a mistake. I would do it like at the beginning both.
Now, regarding medical research, do you remember your first research project?
Yeah, so that was actually like my baby. My first research project was emergency abdominal laparoscopic surgery during COVID-19 pandemic. Actually, I did this work, this research project in the clinic where I work right now. And for me, it was really important because I I was the first author and I led the team. So I learned a lot of like how to do my research. I was mentored by the doctors, and also I learned a lot of leadership skills there. I was responsible basically for the study protocol, data collection, and coordinating with the co-authors, all the things that each one has to do. And our goal for that study was to evaluate the safety and feasibility of performing emergency abdominal laparoscopic procedures during the pandemic, because it was given at the high risk of transmission of this virus, COVID-19. So our hypothesis was that if you follow a strict safety protocols, the transmission will be really low. And our findings confirmed this hypothesis, showing that emergency laparoscopic surgery can be performed if you follow the protocols as it has to be, with the proper precautions, and that the infection risk will be low. So basically that was my first project that I did.
Great. And what advice would you give to someone who wants to start research in general surgery?
Yeah, so starting in research, I think that sometimes can feel overwhelming if you don't have like prior experience. But I think that everything is possible. I think the best way to start is to find a mentor who can guide you. And with this mentor, you can share the ideas, the potential ideas that you have, so you can, for any project that you want to do, especially if you are applying for surgery, research projects, of course, related to surgery. And I think that learning by doing is key because you are going to learn. I think that I took advantage from courses that I got during medical school, but also you can take courses outside from your medical school. Like, for example, I took a course after graduating. It's named Principles and Practice of Clinical Research course. It's made by Harvard. It, it's an incredible course. I would love to do it maybe when I was a student, but I do it when I graduate. But was an incredible course that taught you how to do everything since the beginning. Like, for example, how to do a research question, like use critical thinking, and then you advance with them because it's a program like 9 months, something like that. And then at the end, you're finished with meta-analysis and how to use data. So I think those courses are incredible, are really helpful if you want to learn and start in this world of research. And as I said before, I took this course when as a graduate, and made me realize that it doesn't matter at what time of your life you're taking this course, because always you have something new to learn in research. Is because science is evolving. So I think it's another way to start in the research world.
And what skills or qualities do you think are important for research in surgery? For example, statistical analysis, writing, teamwork, discipline, or others?
Yeah, so research in surgery, I think it requires a mix of technical skills, but also personal qualities. Um, if we're talking about technical skills, so you need to develop your critical thinking because you have to do and start your project with a research question. Another thing is that you have to have basic knowledge, as you mentioned, like for example, for statistics, like how to use this data. And I think that's really important because if you understand how to do it, you are going to understand what are you doing with the data that you collected from that project that you had, and also to understand how to do the interpretation of the results. So I think that's a key too. And another could be writing and communication skills, because I think those are essential. For example, if you want to publish your article, and also because you have to have a good communication with your peers and with the team that you are working. That's if we talk about technical skills, but also beyond that are important personal qualities. One of them is teamwork. Teamwork is really important because you are not working a lot. You're working with a group of people and you have to support each other and always listen to any idea that any member of the team could have. That's really good because it's going to help that the research can go better. And another is resilience, because can happen that you can have a manuscript that could be rejected, and you have to be resilient. You have to keep working and always listen to the feedback to improve your project. And sometimes also can happen unexpected problems that you don't wait to happen, but it happens, and you have to know how to manage those problems. And finally, I think is time management, because as a candidate and an applicant to, for example, the match process, you are not only going to be focused on research, you have to do other things like volunteer, like also taking care of yourself or work. So you have to have a really good organization and time management. And finally, I think that you have to stay always curious, open to learn and to listen, because you always are going to learn something new in this journey and in this world of research.
Okay. And now about clinical experience, what rotations did you do in the US?
Yeah, so I had the opportunity to do several surgical rotations in the US. Each one I think that play a really big role in my person and shaping my career. My first rotation was when I was a medical student. I went to the University of Utah to do this rotation in cardiothoracic surgery. So for me, it was amazing because actually it was the first time that I was in the US, but also the first time that I was faced to another health system, to another technology and another reality. So I think that moment was mandatory for me because I share new experience with different residents, doctors, uh, out of my comfort zone. So I really enjoy it. And after that, as a graduate, I completed observerships. The first, I think, was in California in Adventist Health Simi Valley. I really loved that rotation because I got the opportunity to get simulation with a Da Vinci robot for the first time, and I really love it. I was really amazed by the technology and the patient flow. And then I got the chance to do another rotation in New Jersey in bariatric surgery at Palisades Medical Center in Hackensack. Later, I got another rotation in general surgery, but it was private practice in Chicago. It was also 1 month. And finally, I completed a 4 month rotation observership at DHR Health. Actually, I did 1 month of colorectal surgery. And after that, I did 3 months of acute care surgery. I was in the acute care surgery service for 3 months. So it was an incredible opportunity because I spent a lot of time with the residents, with the faculty. Uh, I learned a lot and I met incredible mentors and friends. And I think that all this experience that I had reinforced the idea that surgery was for me, and I really want to follow that dream.
The next question is a follow-up to the previous one. How did you
Mhm.
get your letters of recommendations?
Yeah, so to obtain my recommendation letters, I focus basically on my rotations in the US. Um, since it's because for when you are going to apply to the match to any specialty, letters of recommendations are really important. But I think that you have to find the strongest and also um, letters of recommendations from US physicians or IMG physicians that did residency in the US and they are working there. So basically, that's the kind of letters of recommendations that you need to apply. Uh, I made sure to give the best of me in each rotation to let them know that I really want to pursue the the specialty in the US, that surgery really was my calling. So I remember that if I have to do pre-runs with the residents at 5 a.m., I was there. If I had to stay until the last surgery, I was there. Because I think it's part of our formation as professionals, but also if you really love something that you are doing and it's your passion, sometimes it doesn't matter how many times you spend there, you really enjoy the process. And another thing that is really important is that you have to build genuine academic and professional relationships with your mentors because I was able to secure strong letters of recommendations that truly reflect who I was, not only professionally, but also as a person. And I think that a genuine letter of recommendation holds a lot of weight rather than a generic letter, because a generic letter that doesn't reflect who you are. It's just like you did a rotation, and that doesn't help you a lot. And another thing I think is that the minimum of letters of recommendations that you need to apply for a program is like 3 letters. The max that you can upload for the program is 4. However, a recommendation is that you should have like more than 4, like for example, 5 or 6. If you can more, that's fantastic. So when you apply to the programs, you can like play with the 7 that you have and group like this 4 is going to be for this group of programs and the other 4 for another one. So you can play with your letters of recommendation depending on the program that you are going to apply.
And about mentorship, what role do mentor play in the match process, especially in a competitive specialty like general surgery?
I think that mentors are incredibly important during match process, and I think during our careers, especially as you said, as a competitive specialty like surgery. But I think that nowadays every specialty is getting competitive with the years. So you really have to have good mentors and a good with a good package of CV and other requirements that you really need. I think that mentors help to guide us through the application process, but also they're going to give us advices on how we can improve and how we can stand out our application. That's the most important. Mentors also will play a big role in, for example, writing the letters of recommendations that you need to apply. I think, as I mentioned before, that letters of recommendation from a mentor who really knows you and who has seen you to grow as a person and as a professional will always be more powerful than rather than a generic letter. And beyond that, I think that mentors will give you emotional support. That's really important. They will encourage you to do better and also to stay motivated in this process that sometimes can be stressful and you really need that support. I think like having mentors who believe in you and who invest also their time to see you succeed and to reach your goal, I think that's the most beautiful and the thing that makes the difference, not only in the match process, but also in your medical career.
Could you share some tips for writing a great personal statement?
Yeah, so personal statement also is really important. Is really important during all this match process and is the difference too. So tips that really helped me was, for example, the first one, be genuine. You have to be genuine, be authentic about who you are and what are your motivations, your experiences. But something important is like you have to share who you are beyond your CV. That's something important because your CV is for your academic things. Personal statement is who you are. Then another thing could be tell a story. Like PS should tell a story of, for example, that connects your background, your experiences, your goals too. And it could be, for example, you can talk about a personal moment that defined why you want surgery. In my case, I talk in my personal statement, for example, about my cardiac surgery, because for me it was really important. And in my case, really changed my life because I think I got the commitment to improve patient care and also to reinforce my empathy. So I think that's a way that you can capture the attention of the reader and also so the reader can know you better. Also, another thing could be highlight your strength, like for example, why you are a strong candidate for them, why you have to be the chosen one, if we can say. You can talk about teamwork, resilience, like working under pressure, but you always have to connect these things with real experience, with things that really happen to you. That's going to be better. And as I mentioned before, don't repeat your CV. The CV is another story, and your personal statement is another one, and you really have to take advantage of it because it has a lot of potential. And if you have time, you can tailor your PS to each program. I mean, for example, if you're going to apply to 120 programs, I don't know, or more, you can tailor your personal statement to your top programs, like your dream programs that you really want to match. So you can customize your statement for each program that you're going to apply, mentioning specific aspects that you really that really impact you or aligns with your goals and with you. And the last but not less important is feedback. I think the feedback is really important. You can share your personal statement with your mentors. You can share it with your peers that maybe they matched before, and they can give you feedback about any mistake that maybe they catch during when they read your PS. And also, the personal statement is a process. I mean, you're going to have your first draft, and then you're going to do another and another one, and it would take time. So also do it with anticipation, because you will need time to think about what are you going to write about. And basically, I think those tips can help to write your personal statement.
When applying to programs or hospitals, there is something called signaling. Could you explain what that is and how you organize it?
Yeah, so signaling now is a tool in the application process that signaling, this tool is for all the applicants. Doesn't matter the specialty that you're applying, but can change like how many signals are you going to have depending the specialty. And this tool is important because it's the way that applicants indicate a strong interest in a specific programs that you really want to go there. And since general surgery is competitive, signaling helps to programs to identify candidates that are really interested on them on their program. And for example, this match process 2025 for general surgery, there were 15 signals. So you have to be wise on which programs are you going to apply. In my case, I prioritize programs like based on factors like surgical exposure, faculty mentorship. Also, I signal programs where I did rotations or I felt that I have a strong connections. So everything has to align at the end with the goals that you have, because programs will be different culture, different requirements, but it will align what you really want. And it's important, I think, as I mentioned, that you have to be strategic, because you are only going to have 15 signals, and you have to be wise and know how are you going to use it.
Now let's talk about interviews. How did you prepare for that stage?
Yeah, so I prepare for the interviews doing mock interviews. I think if you practice more, you get better. And I practice with friends that match before. And also, like with them, I practice common questions like tell me about yourself, why surgery, and all those questions that you can find everywhere. But also, I practice with myself, just looking, looking to myself in a mirror, talking loud, like because I wanted to sound fluent. I have to practice also my English, because as IMGs, English is not our first language. So sometimes we can struggle with some words or pronunciation. So I wanted to do it the best I could. And I wanted to sound natural and not like I memorized this question. Additionally, and I think for me was the best investment, in my opinion, is that I worked with a coach that was who specialized in residency interviews. And for me was the best, because I practice mock interviews with my friends, but also it's really good to practice with someone who knows how is this, like what type of questions you have to expect. I I practice common question, but also tricky questions, behavioral ones, and my coach always gave me my constructive feedback. And all the answers always need something to improve. So I was really happy to listen all the feedback that she had for me, and also challenged me, as I mentioned, with unexpected questions, and helped me to refine my answers. And well, I think that's basically how I did. But the more that you practice, the better that you're going to do.
And how long did each interview last?
Well, so the length of each interview will depend on the program. Some interviews, for example, one of them lasted like 3 hours, but it was not 3 hours of interview that you are talking. I was really afraid of that. But basically, it's just like at the beginning, the presentation of the program, of the residents, the PD, and then you go to the actual interview. That at that moment, and most of the interviews is with the program director, the associate program director, and a faculty, sometimes another attending. um in that case, each interview with each doctor was like 15 minutes approximately, and was in total that. But then you have another type of interviews, like for example, that lasted 1 hour, because they have a 2 day process. 2 day process of interviews, if we can say that. The first day is a meet and greet with the residents that is kind of like a little less formal, but you're only talking with the residents, asking them like any doubt that you have on the program, asking them if, for example, how many surgical exposure they can have, or the mentorship, any doubt that you can have it, you can ask it there. And the second day is the actual interview, and that interview lasts like 1 hour. Uh, I remember that I was interviewed by 4 doctors. One was the PD, of course, one faculty, and two faculties, and one resident, because the chief resident also can be part of the formal interviews. And each interview lasted like 15 minutes again, and in total was 1 hour. So everything that I'm saying right now is about categorical interviews, because when you apply to general surgery, you can apply to categorical positions that is about all the 5-year program training, and the other is preliminary, that is only 1 year position, and then you have to reapply to the match next season so you can complete your training. And in the case of preliminary interviews, because everything I said was about categorical ones, in preliminary, the interviews are shorter, because one interview can last like 10 or 15 minutes, and it's only, for example, when one attending and a resident, or only an attending. That also happened that to me. So I think the duration of interviews will depend on the program, and also if it's categorical or if it's preliminary.
Was there any question during the interviews that surprised you?
Yes, actually, there was one question, and I was like shocked because at that moment I was not expecting that question. There was that if you were a surgical procedure, which one would represent you? And I was like, I was not thinking about it. I didn't think about it, and I didn't practice that question. So I was caught off guard, and I think at that moment what you have to do is to stay calm and try to think really quickly and organize your ideas in your brain so you can give a good answer. I think that my answer, yeah, I remember, was that I would love to be exploratory laparotomy in trauma because you have to be adaptable, you have to work under pressure, and you can impact on life patients just with one surgery. So that was my answer. But at the moment, I thought that I took like a minute to try to understand. But I think that those situations you can handle if you really practice, and also if you practice those tricky questions. Of course, you are not going to know which questions they're going to ask you if it's a tricky one, because the most common questions are, for example, tell me about yourself, why surgery, what do you do in your free time, for example, or tell me about this research that you did. But sometimes those questions are really funny, but also challenging, because you have to really think really quickly and get an answer.
And was there anything you learned during the interviews that surprised you about general surgery programs? It could be maybe the dynamics, the questions, the format, or any other aspect.
Yeah, for example, one thing that surprised me and I really like it is that in all the interviews that I had, they're always ask me about what I do in my free time, balance how I balance work with my life. I talk a lot of work-life balance, and if I got another passion outside medicine, nothing related to medicine. So I think it's really nice because they, as I mentioned before, they want to know you academically, of course, all the things that you did professionally, but also who are you? What things do you really like uh, outside of medicine? I think that's really important and made me realize that really pros really want to know you. And another thing was mentorship. That's something that I really care. Is that, for example, there are programs that they can match with you a mentor in the specialty that you really want, and you work with this physician. But also there are other type of mentorships that, for example, let the resident to make connections and academic relationships with different mentors, and then you can choose which one do you think is the best and which is super specialty do you want to play in the future. So I think those are really important and they mention a lot, and I found it interesting.
How did you feel when you received the news that you match in general surgery?
Yeah, so I felt incredible happy. I it was an excite. I feel really happy with tears on my eyes, but because of the happiness, and it was many emotions at once. I I remember the night before I could not sleep because I was really anxious and everything was uncertain. I didn't know that if I will fully match, partially match, or no match for me. So to see that congratulations, you have matched was amazing, incredible new. And it was really satisfying moment because I realized that all the sacrifice, all the years, all the hard work that I did really paid off and was the beginning of my journey, because I think that starting residency is just the beginning. It's not the end of our journey. We're going to learn. This is to start our story in the specialty that you really want, and of course in the US. So it was like a goal that to be accomplished is amazing.
Looking forward, now that you have matched, how do you feel about your future in general surgery and your training in the US?
Yeah, so I feel incredibly excited for and motivated for what's ahead. I think that the matching in general surgery in the US for me is a dream come true because it's something that I really wanted and I really work hard to have it. I also know, as I mentioned before, this is just the beginning, and I'm ready to embrace all the challenges that residency will have. And I think that I have to push myself to grow every day professionally, but also as a person. And well, the program is 5 years program. So I'm going to be with mentors and residents that will turn into my family because I will spend most of my day with them. And I look forward to develop my surgical skills too, learning for my mentors, my residents, co-residents, and the most important, I'm excited to be part of a strong team. I think that's really important to me. And also, I know that the training in the US is challenging, but that's what I wanted. That's the reason that I applied to the specialty. I know what's ahead, and I'm happy to continue growing, also look for research opportunities, continue with mentorship. That's something that I really enjoy to do because I think it's a way to give back everything that I learned from my mentors and now to give to students or graduates who really want to pursue their dreams. And well, that's basically, I feel grateful and determined that I will continue growing.
Finally, who would you like to thank for your success?
Well, I will first, like, I really feel really blessed. First, thank to God, and thank you to my family, my mom, my husband, my friends, of course, and especially my mentors, because as I mentioned before, it's amazing to have this support, to have this group of people that believes in you and works with you to achieve your goal. I think that's the most beautiful, and I will always be grateful with them, because that's the reason that I'm here, for my work hard, but also because they believe in me and they support me.
Thank you very much for your time, Dr. Tatiana Carpio.
Oh, thank you so much for the interview. I hope that this could be helpful for everyone that want to apply to any specialty. And lastly, I would love to add that it doesn't matter how difficult could be a dream that you want to pursue. If it's really big, doesn't matter. You have to really work hard and to always accomplish the dreams that you really want. I think that that's the most important, to follow your dreams and your goals.